Hi, I'm Dr. Suvarchalaa, Scientific Director with ZIVA Fertility Centers. What are uterine malformations and how do they affect the success rate of IVF is the topic for discussion. Uterine malformations are also known as congenital uterine anomalies. These are structural abnormalities in the uterus that occur during fetal development. These malformations can vary in type and severity and may impact fertility and reproductive outcomes, including those of IVF. Let's look at common uterine malformations and their potential impact on IVF outcomes. So what are the types of uterine malformations? Septate uterus. This is the most common uterine malformation. It occurs when a septum, it's a wall of tissue, partially or completely divides the uterus into two separate cavities. A septate uterus can limit the space available for an embryo to implant and grow. Next is bicornuate uterus. This has, in such a condition, the uterus is a heart-shaped or two-horned appearance due to the presence of a partial septum at the top of the uterus. It may affect the capacity of the uterine cavity, potentially reducing the chances of successful implantation. In a uniconnuate uterus, only one half of the uterus develops, resulting in a smaller uterine cavity. This malformation can lead to a higher risk of preterm birth and other pregnancy complications. Next is diadelphous uterus. This is characterized by development of two separate uteri and sometimes two cervix. Each uterus may have its own fallopian tube. This condition can increase the risk of pregnancy complications, including miscarriage and preterm birth. What is the impact of uterine malformations on IVF outcomes? Now, the presence of uterine malformations can affect IVF in several ways. It can lead to implantation failure. These malformations can create an inhospitable environment for embryo implantation. Irregular uterine shapes, septa, or divided cavities may reduce the likelihood of successful embryo attachment. Some uterine malformations, such as septate or bicornuate uteri, are also associated with an increased risk of miscarriage. These structural abnormalities can interfere with the proper development of pregnancy. They can also cause ectopic pregnancies. Uterine malformations, especially diadelphous uterus, can increase the risk of ectopic pregnancy, where the embryo implants outside the uterus. Ectopic pregnancies are not viable and can be life-threatening as well. There can be obstetric complications also in women with uterine malformations, and it may be higher in terms of risk of obstetric complications during pregnancy, including preterm birth, breech presentation, and cesarean section. These complications can influence the outcome of IVF pregnancies. They can also impose a challenge in embryo transfer. Performing embryo transfer during IVF may be more complex in the presence of uterine malformations. IVF specialists may need to adapt the procedure to accommodate unique uterine anatomy. There could be a reduced success rate as well. Overall, IVF success rate may be lower for individuals with uterine malformations compared to those with normal uterine anatomy. The extent of impact varies depending on specific types and severity of the malformation. It's important to understand these uterine malformations, especially for those who are considering IVF, because you need to consult with your IVF specialist and they will help you manage these uterine anomalies. The specialist can assess the individual's unique condition, discuss potential challenges and risks, and develop a personalized treatment plan to optimize the chance of a successful IVF pregnancy. In some cases, surgical correction of the uterine anomaly may also be recommended to patient before undergoing IVF to improve outcomes. If you have been diagnosed with the uterine malformations or anomalies, you wish to understand your chance of success with IVF, please feel free to contact us. Thank you. A lot of effort has gone into making this video. Please like and subscribe us. Thank you.